You're listening to the Movement is Medicine show, a podcast hosted by Head to Toe Spine and Sports Therapy, a modern chiropractic and manual therapy practice in Edmonds, Washington. Now, let's get into the show. What's up, everybody, and welcome to the Movement is Medicine show. And if you've ever had sciatica or foot pain or that shooting pain that goes down the leg, then this is the episode for you. What's up, everybody, and welcome.
How's it going, Barry? Good to see you, man.
It's good. It's good. I got Dr. James here. We got Dr. Tim, Dr. Ashley, and we're going to riff on sciatica because it's something we see all the time in the clinic.
Yeah, all the time.
Today.
Yeah,
way
I was
too
going to say,
often.
James had somebody today.
Yeah.
It's very common. It's probably one of the more common things that we see here, and a lot of times, related to low back pain, hip pain, those sort of things. And, it's a lot of people end up dealing with this at some point, right, in some way, shape, or form. And it just really comes down to why it happened, right? Like, what was going on? Like, was there some sort of injury? Was this overuse? Has this been something that's been building over time? But really, it is such a common thing, and we do see it all the time here.
Yeah, James, what was the story today with your patient?
Oh, this morning, yeah. Patient came in, that classic, kind of top of the butt pain, and then shooting down the leg into the foot. And I think that separate from the patient that came in this morning was just the definition of sciatica. So I think a lot of people come in with that classic, I got pain in my butt. I got sciatica.
That's textbook right there.
Right? And it's okay, well, is it really sciatica or is it just a tight muscle? How can we distinguish, is it really coming from that nerve or is it coming from something else? So that was the big question I had this morning, just to really, because the patient will come in and he's like, I have sciatica. It's okay, well, is it really coming from that nerve or is it something else? So that's the first thing we figure out as a doctor.
That's a good point you bring up, right? Because there's many things that could be going on that if you just Google search it or you're looking at various, you're watching some YouTube videos or you're trying to self-diagnose, you might land on sciatica, and it may be sciatica. It might be something completely different than sciatica.
I think people will just automatically go to sciatica because it's such a common term thrown around. But I think one of the biggest things that people can focus on in trying to figure out whether it's sciatica or not, instead of throwing out that term, is just, what does your pain feel like? I mean, people can say sciatica and they'll point to their back. People will say sciatica and they'll point to their hamstring or their glute. And really, it's the quality of the pain that you're looking for. Is it true sciatica is more nervy than anything. Mm-hmm. Burning, tingling, some kind of sensation that travels down
shooting,
the leg.
kind of that shooting pain.
Shooting's a good way to
Searing,
describe it too.
Singy.
Yep.
Electrical.
Yeah. But you don't want to call sciatica if you just have back pain or pain in your glute. So I think a lot of people just, throw the term out, but it's really just recognizing what your pain is, what the quality is.
The quality and the distribution, I think, are the two big things that are able to determine.
What are you feeling? Where are you feeling it? And so that's where we start. Number one, diagnose.
Yeah. Mm-hmm. Yeah, that's the biggest thing to start with is to diagnose it because, both Dr. James and Dr. Ashley said, literally so many people that come in, it's my sciatica's acting up, and they go in it's right up here, and they're pointing to their low back, mid back, or somewhere in their leg, and it's kind of describe your pain, right? What's going on there, right? And it's if it's not some of those nervy type pains that we were talking about before, then it might not be sciatica, but it does come down to us to diagnose it, and that's what's really important about that phase, right? Because that's our job, is to figure out, okay, is this sciatica? But then also, if it is sciatica, what is it coming from?
What's causing it, right?
What's causing it? Because there's multiple things that could be causing it.
What are some of the common ones that we see?
Yeah, so some of the most common ones that we would see could be coming from the low back itself, right? Could be pressure on a nerve root that starts in the lumbar spine, okay? When we're talking about sciatica, a lot of times what we're talking about is the sciatic nerve. I think most people know that, but just to be
straight
out, it's the sciatic nerve that we're talking about, okay? The sciatic nerve is the biggest nerve in your body, okay? And it kind of passes through the glute, but it starts in the low back, all the nerve roots from the lumbar spine that then go to form the sciatic nerve that then runs down through the glute in the back of the leg, okay? Now, from the back itself, like I was saying, the first thing that we really want to look for is okay, is this coming from the lumbar spine itself? Is this an issue where we have an issue with a disc that might be placing pressure on one of those nerve roots that then irritates the nerve root, and then we experience some of that nerve-like pain down the back of the leg, okay? So that's one of the first things that we always check into to see, okay, we got to rule that out first, because if it's a disc issue, then it's a different type of treatment plan versus maybe sciatica coming from like a peripheral, like somewhere further down the line, right?
Yeah. I think, some of that, like the peripheral nerve, once it passes out of that glute, then that sciatic nerve goes down the back of the leg and can branch off into all sorts of other even like peripheral nerves from that sciatic nerve, and then it's getting trapped by either like just like a tight muscle. It can kind of be entrapped. Like mostly muscle tension, like the fascia, everything, any kind of connective tissue. And that's going to play into that distribution again. So you might experience it just like, just that bottom of the leg instead of like the glute or anything above. So again, the whereabouts is going to tell us kind of whether it's happening in the peripheral nervous system or kind of coming from that low back area.
So step one, we diagnose. Step two, then we kind of fine tune, like what are the causal factors here? Where is it originating? What down that kind of chain of various things can go wrong. We work through that. Yeah. Then what does treatment start to look like?
Well, like Dr. Tim said, it depends on where the pain is coming from. On the least severe end, it could just be a referral pain, like a muscular referral pain, and obviously, like Dr. Tim said, it's something we diagnose. There's a multitude of things that you can do in terms of like lumbar disc decompression, if in fact it is some kind of nerve root compression coming from like a bulging disc, say for example. There are a few things neurodynamically that you can do, like down the leg, right? You can do like a nerve floss type of deal. You can decompress using cups. There's a bunch of type of like soft tissue treatments that we can do. But at the end of the day, it really just depends on where it's coming from. I will make a point in terms of like nerve health. Nerves in general don't like to be compressed or stretched. That's how you irritate them. So at the end of the day, we have people coming in here with sciatic or nervy pain trying to stretch out their hamstrings. But if it in fact is coming from that sciatic nerve, you're probably making it worse as opposed to better, which is why most people are like, I don't know what's going on. I'm stretching all the time and I'm still not getting any better. So like the safest thing to do, if you think you have sciatica, don't even try to self-treat it on your own. Go seek some professional help.
Yeah, we don't always say that. There's lots of things that and a lot of resources we provide on self-care, and we're huge on self-care. And frankly, if we can get you to fix something at home, we want you to do that.
Absolutely.
We don't want you to, we want you to get as quickly as possible from point A to point B. But in this case, oftentimes self-care, self-treatment can make things worse.
Yeah.
It can. You could be doing the wrong things, right? And I mean, like we were saying, like we're kind of been like keep coming back to this point where it's like because sciatica could be caused by multiple different things, whether or not it's like a disc in the low back, whether or not it's compression on the nerve through some muscle in the glute, hamstring, or something like that. Maybe it's referral pain, like Dr. Ashley said. But if it's, like for somebody who's untrained in this type of stuff, right, it's really tough to know that. Like it would be really almost impossible to know where this is coming from.
Yeah, you can't self-pinpoint that.
Yeah, so it's like because this is one of those conditions where there's multiple things that could be causing it, seeing a practitioner, like seeing somebody like us to actually we know exactly how to diagnose this stuff to figure out where it's coming from, because then we can set you on the right treatment plan, right? Because treating sciatica from like a lumbar disc type issue versus treating sciatica from like a, piriformis syndrome or like, tight muscle in the glute or hamstring, those are two completely different treatment plans, right? And you're going to attack them differently based on what you have going on. So figuring out exactly what's happening out the gate is really important.
And our number one message, though, is this is a very treatable condition.
Absolutely.
Yes. That was one thing I did want to touch on, because a lot of people, when they have some of this stuff happen, because you're noticing nerve pain, even if it is a disc type issue, a lot of people go down the road of like, oh man, am I going to need surgery? Right? It's like, am I going to need to like get something done to do this? And like, I would 90% of the time that's not the case, but people can get scared doing that. So if you're experiencing this at home, don't like, as much as you try not to be scared about it, but just come see somebody about it. That way we can tell you what's going on and diagnose it correctly. Yeah.
I love it. I love it. Well, guys, thanks. This was really insightful. And I know this is something that is quite common, but quite tricky. And when you're in that kind of situation, that is the exact right time to find an expert and get some help, because you can get back to doing the things that you want to do. A lot of times I know we have had people come in who have stopped running, or they've stopped exercising, or they have a hard time sometimes even walking. And it's like, you shouldn't live life like that. Like, we can fix this.
Yeah, totally
absolutely.
True. Yep.
Awesome. Well, guys, thanks for being here. Thanks for the show. Thanks for the insight into sciatica. And as always, movement is the best medicine, and we're here to help if you need us. Book online, and we'll see you in the clinic. Thanks, everybody.
Awesome.
Thanks, Barry.